The exercise I will be discussing today is the upper and lower chops in a half kneeling position. This is part of the functional strengthening rehab phase, and the exercise prescription is usually 2 to 3 sets of 10 to 15 reps per side, but this does depend on a lot of different factors. A progression would include increasing weight if it's on a cable machine, as my demonstration shows, placing an unstable surface below them, adding a movement, increasing speed, or increasing sets and reps. So for adding movement, you can do a lunge to a chop so they can start in a standing position. Step foot forward into a lunge. As you descend, perform the chop motion. When you increase speed, once you master the form, performing the chop more explosively with control can be a progression. In terms of regressing, the lever arm can be shortened, and instead of extending your arms fully, you can keep them slightly bent during the chop. This decreases the torque, making the exercise easier. You can also change the position, so if the half kneeling position is difficult, then they can be performed in tall kneeling or even standing just to provide more stability. Or the range of motion can be reduced, and instead of crossing the entire body, then they can only do part of the movement. You can also decrease sets and reps, and the weight. You would discontinue use when the pain is greater than a 3 out of 10. If numbness and tingling occurs, they cannot be completed, or they are moving on to a different rehab phase. You would progress when exercise can be successfully performed with the current weight, sets, and reps, and no discomfort or pain is experienced during the exercise, and that it is done with the correct form and proper execution. Now, to perform the upper chop, the patient will begin by setting the cable machine anchored low to the ground. They will stand next to it and come to a half kneeling position. So the knee closest to the anchor point will be on the ground. Then hold the handle with both hands, arms fully extended, while keeping your arms straight and engaging the core. The handle will be pulled diagonally across the body and upwards, and your hand should end above your opposite shoulder. So this motion will resemble a chopping action. Throughout the movement, the patient should remember to keep their hips and torso square and resist the urge to rotate. Only the arms should be moving, and the power should be coming from the core, not the arms. And the same principle applies to the lower chop, except the cable will be set to a higher anchor. And then in the half kneeling position, the knee farthest from the anchor point um, is on the ground, and arms will remain extended, etc. And then this will resemble a chopping motion going downwards. So these are the two examples. Thank you.